Good evening, everyone, and welcome to my YouTube channel, Pain Free Partha. And all my slides are freely downloadable and editable in www.painfreepartha.com. Today, I'm going to talk something in artificial intelligence in obstetric anesthesia. So I will touch upon anesthesia first, and then I will go to obstetric anesthesia. Okay. Now, many people will think, what is this artificial intelligence? Artificial intelligence is the ability of a computer or some machine to perform tasks that require human intelligence. You make the machine think. You make the computer think and do. That is what is artificial intelligence. They act like human beings. Is a broad concept of creating machines that can mimic human intelligence. Okay, something like human intelligence. Now I will go to what is machine learning. Machine learning is a specific subset of AI that focuses on enabling machines to learn from data without explicit programming. It enables machines to learn from data, but it has not got specific programming. For example, now you take an email. Okay, there are a lot of emails coming, and you just feed that these are all spam emails. Okay, and then after some time, when it receives such a mail, it tells that it is a spam. Okay, this is what is called machine learning. Now, what you do is you explicitly program the computer. The spam is deleted. Spam is deleted automatically, or spam goes into a folder, something like that. So that is explicit programming. So what is machine learning is just it tells now you have put in a data. It tells that it is a spam. The new one is a spam. That is what is called ML. Now, why I want to talk this like this, artificial intelligence, machine learning and all, no. Because in the year 1951, there is nothing. 1971, there is nothing. 2005, the PubMed articles, means that is related to medicine and artificial intelligence. It is around 5,000 or 10,000. Now it is, see, in 2024, it is 37,000. So many are focusing on artificial intelligence. Now, what about anesthesia? Before going into obstetric anesthesia, what is about anesthesia? Enhanced predictive analytics. Now, you see, predictive analytic is better. What is that predictive analytic? Now, you see, it can predict patient outcome. So this patient will go bad. This patient will not go bad. All these things will, this patient will go bad on 8th day or on 8 to 10 days, something like that. So improved decision making. How we can tell this patient A has told the patient can go bad after 7 days. So we can have individualized patient care. This patient can be kept in the ICU for 10 days. Improved precision in procedures. AI supported tools can perform tasks like intubation. Now you keep the ultrasound machine here. Now after 10 seconds, it will say where are the nerves. The nerves will be in yellow. Now you keep an echo probe and get a 5-chamber view. It will tell all the EF and all these things. And now AI is going to tell wherever you put the echo probe, it is going to tell shift to 30 degrees, go a little more 1 centimeter above, and you will get the 5-chamber view. Keep it in there for 10 seconds. I will give the EF and all the other things which you need. So improved precision in procedures. Real-time monitoring and management. For example, now AI algorithms, patient BP, pulse rate, everything it can monitor. It can adjust the anesthesia levels, misindexed agent or TIV, or BP fall given vasopressors. All these things can be possible. Real-time monitoring and management. Crisis support systems. When the patient comes with something bad, clinical decision support can be done, potentially improving response time and outcomes. Now the patient comes, you have fed all the data like that. Patient comes with giddiness, a 35-year-old lady. So it can tell that there is a possibility of ectopic. So this is crisis support systems. Now we will go to what is in obstetrics. Now we have told what is in anesthesia. It can analyze, it can give drugs, it can monitor, it can give robotic drug intubations, you can give artificial intelligence associated nerve blocks. All these things are possible. It can assist you in clinical decision making. Now, what is an obstetrics? It is a decision support model. They et al. Developed a decision support model. Lasso regression. We will not go into the details. Predict the individual dose of intrathecal hyperbaric bupivacaine during cesarean delivery. So 0.5% is needed. How much? Definition of appropriate block. What do you mean by appropriate block? I want block between T4 to T6. Okay, 15 minutes at least prior to after administration of the block. So Bergman block. Below T6 or above T4 is inappropriate. All these things we have fed. And now it takes all the age, all these things, pregnancy, all these things, and tells 1.94 plus or minus 0.2. And what we have given is only actual dose is 1.94 and predicted age is 1.94. Sometimes we cannot, somebody will tell it, I will put in sitting, I will put in L4, I put in L2, all these things. OPR, I've added buprogesic, and the height is 140, height is, all these things we can add in AI to tell exactly how much hyperbaric bupivacaine is needed for LSCS for this patient. Now this is about the effect. I want 2.2 ml to be given for this patient at L3, L4 level. This is what is about the effect. Now about the adverse effects. Yes, it predicts hypotension. Now we can see explore neural network to predict hypotension after spinal anesthesia for elective cesarean delivery. Now it assesses all these things and tells this patient will get hypotension after 3 minutes. This patient will not get hypotension at all. It predicts hypotension. This is non-invasive examination of arterial stiffness variability. Yes, interpretation of various arterial blood pressure wave points to detect early serious deterioration. It can undergo pulse contour analysis by neural networks. I will come back. What is a neural network? Warn for hypotension. Yes, it puts it here and tells you are going to have hypotension in the next minute. Now, what is NLP? NLP is a branch of AI that helps computers understand and interact with human language. It allows machines to read, write, and respond to text or speech like a human. This technology powers digital assistants, chatbots, etc. What is this? This is an echo dot. Now you give some human language. Yes, it interacts with human language. You allow it, respond to text or speech. It responds to text. You switch off the light, it does. It's dim the fan, it does. Dim the light, it does. All these things it does. It interacts with human language, speech, and allows machine and does the work. This is what is called NLP, natural language processing. It also has the risk of postoperative mortality prediction. This is a deep neural network. What I want to tell in this is, somebody will think, what is this neural network? Okay, we have fed something superficial and deep neural network to tell. Now I say in Trichy there is a house. Okay, in Trichinopoly of South India there is a house for me, and the house is in Chindaman, and the square feet of plinth area is 1200, and the whole plot area is 4000. Now it will tell what is the cost. It will tell it is 1 crore. Now this is what is called superficial neural network. We have given only superficially, and this superficial neural network, it analyzes the house to be according to this, it is 1 crore. Now what is deep neural network? Now you tell the computer, my house is in Chindamani, it is 1200 feet plinth area, and it is 4000 plot, And the plot is a corner plot. And the plot is completely square or octagonal. Or the gates, doors, all these are made of teak wood and fully granite kitchen. All these things you add and then ask the computer what is the cost. It will tell us 1.3 crores. It is what is called deep neural network. Now, what do you know? What is superficial network? And you have a plot in Ramnagar, Coimbatore. This plot is in Ramnagar, Coimbatore. It is 2,000 square feet. You tell the rate, it will tell 1.2 crores. Now, if you tell the plot is slightly polygonal like this, and there are no houses by the side, then it will come down to 80 lakhs. This is because of the deep neural network. Okay, convoluted CNN is a part of DNN. The model utilized preoperative characteristics and free text clinical notes of 1 lakh patients. It outperformed traditional learning models. NLP, natural language processing, considering disease severity. Yes, what is that? Yes, this is the risk of mortality in this patient. It predicts. Robotic systems can do intubation. It can produce nerve blocks. AI pediatrician can optimize fluid management, and now it will automatically tell that you have to give ephedrine. Now automatically it will tell that you have to give another fast oral. Now, what is epidural analgesia? This is what is the accurospinal navigation systems. It's a handheld ultrasound device that uses a proprietary algorithm for computer-aided image interpretation, trade identification of space, depth of epidural, everything. Now you put the scan here and it is AI fitted. It will tell how to go with the needle, change left, right and all. It will tell where you are in the ligamentum flavum, everything. Live we can go even with a paramedian approach. This is accurospinal navigation system. You go and see Rivana. In difficult obese with obstetrics, they use optical reflectance spectroscopy. What it is now you see as soon as this AI put this is optical reflectance spectroscopy means how much light is coming back. This is what is a simple thing. Optical reflectance. It analyzes as ligamentum flavum and tells you that you are in the ligamentum. You are in the dura. Now the space is epidural. This is what it will. Now we know effective, no motor blockade, no hypertension, no nausea. Prediction of hypotension and hypoxia is slightly underexplored, mostly of non-pregnant. An ensemble model based ML machine learning. Now you tell what is this ensemble model? Ensemble model means there are two models, okay, and the output is coming, and you assemble this and put a thing. Now I will tell what is a model. Okay, model means, for example, now if you ask me what is your name, I will tell Parthasarathy. If you ask me where are you working, I am working as professor in Mahatma Gandhi Medical College. Now, if you ask me who won the tennis Wimbledon in 1978, how will I know? Now, what the data is put into me, tennis overall one, football overall one, athletics overall one, everything of sports is within me. And if you ask me who was the football champion in 1993, I will tell. Now, I became a sports model. So I'm very specialized in sports. This is what is called a model. Now, there are two models, for example, when you get the output and you ensemble them to give. This is what is called ensembled model of machine learning. I have already told what is machine learning. Learning means you give the data, it will tell what is to be. It will not do automatically. Explicit programming is not there. Then it becomes AI. What is AutoScore? AutoScore is an innovative tool that uses machine learning, create a clinical score for breakthrough pain during labor anesthesia. Epidural. Now, you are given an epidural. You are given 10 ml of 0.15% bupivacaine with fentanyl. This patient will develop, when will it develop? Now at around 8 p.m. I have given that. 10 p.m. you will get breakthrough pain. The auto score will tell. Breakthrough pain. When it will come, it will tell. How it will be, how intensive it is. Yes, it will tell. Now we can ideally analyze what is to be done exactly to improve patient care, identifying risks. It takes care of 6 modules. So this is an auto-score innovative tool which assesses the risk of breakthrough pain. Now the use of patient-controlled anesthesia with remifentanil for labor anesthesia is a useful modality. Now, if you don't believe in epidurals, or the patient doesn't want an epidural, then we can put IV PCA, remifentanil. What it will tell is, now previous patterns, if it analyzes and tells, I'm going to get contractions. It anticipates uterine contractions. Yes, we can give slightly earlier before the pain comes. Now you are going to get the pain in another 25 seconds. Press. This is what is done by AI in IV patient control anesthesia. Now, if a birth plan, if AI platform is our chat GPT tells breathing techniques massage, Gemini tells breathing massages, warm compressors massage, Copilot tells breathing technique massage, UChat tells man, I would like to access to pay all pain, but breathing techniques massage hydrotherapy. I am open to all pain relief, but prefer to take natural methods first. So what you have done is write a birth plan for a first time mother, means it tells like this. Now write a birth plan for a first time mother who does not prefer natural techniques. Now it will write a birth plan for a first time mother who does not need like natural techniques and does not like an injection in the back. So it will tell a birth plan. I am going to PCA IV. Something like that it will tell. So you have to prompt the AI. You have to prompt the AI how to get the answer. This is what is called prompt engineering. So unless you prompt the AI properly, it is going to give a lot of pages of answer, which it will be focused. AI can play an important role in preoperative risk stratification and airway assessment. Yes, you give all the data, it will tell it is risk 2, 3, 4, everything. It will assess the airway. Yes, analysis of data with photos, videos in 970 patients. Cardax has created first AI-based model. See, I have told no, I am a sports model. This is an airway model. That is what is called a model. Statistical face models, facial morphology parametricization for predicting difficult intubation. There are so many airway models. Hayasaka's model. CNN means it's a type of deep neural network. It is called convoluted neural network. What did I tell? Deep neural network means you have to tell the site of plot, this thing, house, how much print area, teakwood or something, whether any chimney is fitted, or how much the marble, all these things are put. If the house is insured, then it becomes deep neural network. So CNN is a type of deep neural network. Deep learning by linking the patient's facial image, their model's accuracy and specificity. See here, there are another. So many people have created models. Now this is explainable AI-driven pre-hospital emergency airway. XIPEA, explainable AI-driven pre-hospital airway assessment. You give photos like this. Already there are innumerable photos. It will tell that is airway is easy. This is what is called airway predicting AI. Can AI decrease unnecessary surgeries? Yes, ultrasound, MRI. There are a lot of ML algorithms to detect the need for cesarean or vaginal deliveries. I am not going into those details because it is out of anesthesia. Critical care in obstetrics. There are early warning stores, modified early warning stores, national warning score systems. All these things are there, but electronic cardiac arrest discharge outperformed all these scores. Now you see this is epic deterioration index. Here this is the epic deterioration index. Now you can see this is MODI warning scores. It outperformed your epic deterioration index. This is AI, which outperforms all our warning scores and close to clinical. Yes, machine learning, yes. Deep learning, yes. Computer vision, only in your axial procedures. Natural language processing is critical care obstetrics. This is airway, labor anesthesia, everything is there. Yes, can I reduce cost? A can have automated tasks, scheduling, documentation, billing, reduces the time resources spent on this process. Healthcare professionals can focus on patient care. Now it will tell automatically if you put out critical care uh, beds are 10 and 3 is occupied, 4 is occupied, how many staff are needed in the night, everything it will analyze. How much is the volume entering daily in your night duty, it will analyze everything and tell only 3 staff is enough for your night duty. So it is reducing cost. Many are just proof of that's a problem, limitations. Proof of concept phase. AI really rely on objective inputs. What you have given only it will think and contribute to. It is not able to account for emotions and thoughts that contribute to human decision making. Now, some people will tell, I don't want this prostatectomy today because my son is coming from Bangalore day after tomorrow. This is emotions and thought. AI cannot resist. Think outside the box is limited. It will do black box. Implications from medical, legal, ethical. Now I have a patient. I diagnose this as ectopic because of AI. Is it okay? Is it okay ethically? It is medico-legally okay. All these things have to be supported by the medical officer. Supported by the medical officer. The accuracy is hugely dependent upon how closely patients trained data, how it is got trained, how much data set is given. That is what is depends on the accuracy of it. Underrepresentation of certain such as minority may skew the data sets, give rise to bias. The problem is fabricate references and information. Now, you have hundreds of articles coming from one university or two universities, and all are created as evidence, which are actually not written and not done. Fake fabricate references and information into the AI, then the AI becomes ill-equipped, and all these things will be output will not be predictably good. The onus is on the end user. I am the end user. I am not well trained in a, oh boss, I have given epidural for 35 years. I have not failed in many. So why should I need a? So the onus is on the end user. If he is ill-equipped, then there's a major limitation. What is the future? You need to have a white box approach, explainable algorithms. Now you have an algorithm which tells that this patient will have go bad after 8 days. It predicts the postoperative morbidity and mortality. But how does it do? It needs a white, yes, this is what I have analyzed like this, and all these patients, yes, this is what is called white box approach. Tools could be applied to obstetric anesthesia by training complex procedural skills like epidural and placing invasive lines. What is the essence? A difficult airway prediction system that analyzes. It assists neuraxial anesthesia, spinal, epidural, real time. A prediction system for BP fall and closed loop auto infused vasopressor. For epidural or intravenous labor anesthesia closed system, a breakthrough pain it detects, auto score, innovative, it predicts and gives epidural. To teach the principles of AI as a part of anesthesia resident curriculum. Any technology, the innovation will be there. Peak of inflated innovations, there is some delusion, and it goes on to develop. Fabricated. AI can create fake research papers. It can also create fake images, mislead people. That's a major problem with AI. Now I'll tell you what is this. This study is about an RCT which investigates the effect of 5 milligram diazepam in the night on HbA1c. We enrolled 100 patients, 30 to 70, two groups, 50-50. Diazepam one group, placebo one group. Secondary outcome, first day outcome. You see here, the sedative group, significant reduction of HbA1c, more than 20%. 5 milligram oral diazepam in the night treatment significantly reduces HbA1c levels. What is this? Just I prompted the AI to write an abstract for an RCT that 5 milligram diazepam is beneficial in reducing HbA1c in uncontrolled diabetes. The result is like this. Now you see, nobody has done the study, nobody has done anything. This RCT is given by AI. So AI is not going to replace physicians, but physicians who use AI are going to replace physicians who don't. And that may be a cautionary tale. Yes, www.painfreepartha.com, my website for all the slides, freely downloadable. And you can visit me on YouTube and listen to my lectures at Pain Free Partha.